Hello, I'm Dr. Simon Ruffell. I'm a psychiatrist and a researcher based at the Psychae Institute, University of Melbourne and Icaro Science, UK.
And hello, I am WaiFung Tsang, a researcher psychologist based at King's College London, and also an ayahuasca researcher at the Ayahuasca Foundation and Icaro Science. And you are listening to Professionally Psychedelics.
Where do they go, the smoke rings I blow each night? Oh,
Hello, listener, and welcome to the Professionally Psychedelics Podcast. I am delighted to welcome two guests today, joining us from King's College London and the Psychae Institute at the University of Melbourne. We have Dr. WaiFung Tsang and Dr. Simon Ruffell. Over the interview, we're going to look at some of the research projects that the doctors have been working on, how they can be applied in practice, and what needs to happen to ensure we get to a place where psychedelic medicines move from taboo to part of people's wellness regimens. I cannot wait to get going. So, without further ado, WaiFung, Simon, welcome to the Professionally Psychedelics Podcast.
Thank you. Pleasure to be here, Jonathan.
Thank you so much.
So, guys, as you know, our first and customary question on the pod is, what led you to plant medicines?
Yeah, I mean, that's a good question, Jonathan. It's actually one that comes up relatively frequently. Originally, it actually started about 5-6 years ago. I've been working in the NHS as a doctor, and I've been working in psychiatry. And I decided to have a bit of a break, and there were a few reasons why I decided to have a bit of a break. You know, I think it's good to take breaks from working in such a stressful environment, but also I think one thing that was quite evident, and one thing that I was finding quite tricky, was the lack of effective medical treatments that we had for our patients, and this led to people quite often coming back into hospital in a revolving door kind of way. It's not always the case. I'm not against psychiatric medications, not at all. I think they have an important and prominent role, and they can be effective for some people. But there are also categories of mental health conditions where it's perhaps we need something else. And so I decided to take a bit of a break, and I was spending some time out of the UK, and actually came across somebody who was training to be a shaman, training to be a curandero. And this was in Central America. And we were roughly the same age and the same grade, and we got talking about plant medicine and about the role it could have in treating mental health problems. And he was telling me all of these amazing stories of healing that had come from the jungle in the Peruvian Amazon. And he seemed to be focusing on this thing called ayahuasca, and I was really intrigued. I'd heard of ayahuasca, but I'd been very much waiting for the right time to drink it, which is a bit of a cliche thing that I think everyone who's into plant medicine says, but that was genuinely true. And this guy seemed legit, and fortunately it was legitimate. And so I ended up, which I'm super grateful for, ended up going down to the Peruvian Amazon with him to the retreat center that he was based at, called the Ayahuasca Foundation, and there I did my first ayahuasca retreat, and was completely blown away by the results that we were seeing from the participants at that retreat, and also, to be completely honest, the effect that it had on me too. Once I'd done that retreat, I've been interested in psychedelic research for a while, and I was keeping track on the research that was coming out, and I started looking more deeply into ayahuasca and the research that was out there. And there was some research looking at ayahuasca, mainly in the churches that combine Christianity with ayahuasca throughout Brazil. But there was very little, pretty much none, looking at ayahuasca through a scientific lens in retreat centres in the Amazon basin. And so I contacted one of my friends, Nigel Netzband, who makes up the third part of our research team, along with WaiFung. I contacted him and explained about ayahuasca, and we started immediately planning how we could start researching ayahuasca, seeing as there seemed to be this gap in the literature in terms of the traditional use of ayahuasca. We tried to get some funding to fund our first study looking at the effects of ayahuasca on personality, but unsurprisingly, nobody wanted to fund us at that time, and so we actually ended up self-funding our first study. after that, it just seems to have snowballed. And fortunately, we did get some funding from the UK government, from the Medical Research Council, to do our most recent publication. And also I've just got some more funding after that. So fortunately, the projects keep coming. But for me, that's how I came across it. And yeah, WaiFung.
Thanks for that. Yeah, I guess share a bit of my story. It was all a bit serendipitous, really. Just to kind of rewind a little bit, Jonathan, because I'm actually currently working towards my doctoral title at the moment as well. I'm training for at King's, just for that intro at the start. But I've been working as kind of like a researcher, a psychologist on the team. I first met Simon in which is kind of like working at the Maudsley Hospital, and yeah, we both kind of shared this interest in a kind of alternative healing and psychedelic medicines, namely ayahuasca. And I guess I came from quite a similar kind of route in terms of finding the medicine as well. It's kind of just like working a lot in clinical services. I spent a lot of time working in addiction, especially, and then kind of seeing this revolving door phenomenon just happening where people would kind of come in and out, and just from a psychology point of view as well, where kind of talking therapies might not really, the accessibility of them was not great, and then the efficacy of them kind of varies between people, and just generally the resources, the NHS kind of reflecting that as well. And yeah, it got to a point where I was like, oh man, it felt a bit kind of I really wanted to kind of like expand a little bit. Is there something else out there? And then, started working in addiction, kind of like hearing kind of like personal stories from people who have had, received benefits from psychedelic drugs as well. And then kind of looking into the literature and just finding the data to be really good. And then also kind of my own, because I play a lot of music. I'm a musician. And then, so from that kind of part of my life, I was kind of often, so like, I guess, kind of drug use and alternative kind of like therapies had quite a common place in my own personal social circles. So I've always kind of been interested in the potentials of them. So kind of developed the training for kind of these novel psychoactive substances, which included psychedelics for the service that I worked in. And then, from there on, kind of just kept diving more into it. And then once I met Simon at the Maudsley, that was when we really started that working relationship. And then, joined onto this project in the Amazon, and the rest is history. It's been quite a journey, really. Yeah, I've been doing that for the past few years now. Yeah, it's been really, really, it's been real.
And you guys said that you self-funded your first research project. Now, I might be wrong on this, but it doesn't, to me, I don't know of too many other medical practitioners who have been able to self-fund their research projects. How did you guys go about this? And was it a case of raising funds, or what's the story behind that?
Yeah, for sure. I mean, again, a few things happened at once, and it was very much the case of being in the right place at the right time. So when I first ended up at the Ayahuasca Foundation, the man who runs the centre, Carlos Tanner, had just received a large amount of funding to build a research centre. So he had this idea that he wanted to conduct research into ayahuasca at the Ayahuasca Foundation, but he didn't have any researchers. And at that point, he also didn't have a centre. So when I was there and started talking to him, and he was looking for a researcher, for a doctor, my ears pricked up. And I've been working in Uganda previously. I've been working with child soldiers, doing some research there, and I was beginning to get ready to look for a new project. And so I felt ready to do that. Fortunately, because of the setup, it meant that we could conduct this observational research, which is where you try to have as little impact as possible on the participants and on their experience, which is different to when you conduct controlled research in a laboratory setting. And that's what really makes the research so expensive, because you're trying to control for everything. But for observational research, you can actually do it much cheaper, depending on what you look at. there were some costs, and unfortunately, well, I was going to say unfortunately, that sounds really bad. I just received some inheritance from the death of my grandma, so thank you very much, Grandma. And so that money went towards the relatively low costs for that initial project. So that's how that happened. But as we've began to expand, the projects have become a bit more complex, and that initial project was looking at ayahuasca and personality. And so we were assessing the effects of ayahuasca on personality using some psychological inventories, which was relatively low cost to run that study. When we did get funding from the UK government, from the Medical Research Council, that meant that we were allowed to get a bit more serious with what we were looking at. And so we started looking at the effects of ayahuasca on gene expression. And so that obviously requires lab work, and so the costs are higher.
And sorry, just to sort of touch on that. So once you've done sort of an original body of observational research, what did you put towards the fund grantors at the NHS? Sort of how did you guys present your research to them, and what was it about it that compelled them to dip into their own pockets and support you guys further?
So the grant actually was from a particular pot of money, and that was supposed to support the development of new treatments, which is an interesting idea in itself, and we'll come back to that in a sec. But to support the development of new treatments between the UK and between developing nations. So it was a pretty specific pot of money, and we were fortunate enough that they were open to us looking at ayahuasca. When I say new treatments, the reason that I hesitate there is it's novel, perhaps for us, perhaps it's novel for people in the West, but it's no.
These are ancient compounds.
No, exactly, yeah. And so I feel like a fraud, kind of even saying, "Oh, the money was to look at new treatments." It's like, well, I mean, that's obviously completely the opposite of what we were looking at. So just to flag that there as well. But I think the idea is novel ways of treating mental health problems in the typical Western academic structure.
And the funding was also namely for childhood trauma as well, from Medical Research Council. So yeah, thank you very much, MRC. Yeah, but nonetheless, I think like everything up till then was kind of was very much out of our own pockets, and kind of from the work that we would have we still will have kind of full-time jobs, and then it was such a massive kind of passion project to be doing this alongside it, and then making the time for it, and then taking the money out for it. Even when the MRC kind of helped us out, and it was amazing, but even still there was kind of a lot of other costs incurred. And so it's actually pretty amazing now seeing the development that has been seen in psychedelic research in general, and the amount of funders, the people who have shown interest, and so now it's become quite a different kind of ball game. But yeah, slowly getting more interest in it makes lives a bit easier. Yeah.
And WaiFung,
Hi.
Talking about the research itself, could you give us some insight into how your research projects have expanded and developed from that initial observational early stage?
Yeah, well, so like Simon was saying, the first project was namely looking at kind of personalities, which is just generally a much kind of low cost project, and a big part of what made it quite so low cost is that observational nature, and also the kind of the fact that the medicine kind of grows there and is being provided there, and then people at the Ayahuasca Foundation has they take the role in recruitment of the participants, and and we also really wanted it to be kind of like kept in the safeguards of the tradition in which it has developed over all of this time, because it's one thing to take it in the lab, but then this idea of the ceremony and the indigenous kind of input that's developed to help people navigate through these really deep psychedelic spaces was quite an important aspect of the research that we wanted to, I guess, like uphold. So like after we kind of started this kind of self subjective measure study, then once we had the support of the MRC, then we were able to look at more biological information as well. We recently published the study, the first ever kind of DNA study in psychedelics, And then now from there, we managed to kind of gain more interest. And then now there is kind of like talks of being able to run from this pilot essentially and look at a bigger sample and make the study bigger and better. And then also working with different institutions worldwide to help us with the bits that, with making this a more legitimate, but also kind of more, going at it from more angles, I guess is a good way to put it. So now, for example, Simon with the University of Melbourne can, coincide with bringing this to the lab as in parallel with the jungle, but then also talks of, for example, looking into the microbiome and stool samples, basically looking at people's poo, which is also quite exciting. So so we are slowly expanding more into having more resources to do these kinds of things.
In your opinion, two folks that have direct experience working in and with the NHS, how do we go from a place where we're looking at very much ancestral medicine that does have a rich history of ceremonies around it, and at some point down the line integrate that into the traditional medical structure that we have at the moment?
Yeah, I think that's an incredibly complex question to answer, and it's one that we're beginning to try to answer now. So in collaboration with the University of Melbourne, Psychae, which is the organisation that I now work for, are just starting to run a lab-based randomised control trial looking at ayahuasca for the treatment of depression and some other things. And this is a really big question. I think there are different ways that ayahuasca could exist within a Western paradigm. One of them is through the Western medical model, and the other one would be more independently. So you do get some more alternative medicines that act outside the prescribed medicine from the NHS or from whatever the governing body is. So a nice example of this is acupuncture. So acupuncture isn't recommended by NICE, which is the National Institute of Clinical Excellence, but it has its own regulatory system. It has its own board, and you can go to private practices in order to get treatment. And so perhaps ayahuasca could exist in a Western paradigm, in a framework like that. When it comes to using it in a Western paradigm, it's extremely difficult. It's extremely difficult. I think one of the most beautiful things about ayahuasca is that the tradition is still there. So for things like psilocybin, when we use that in lab settings, when we use that in research, we can have an idea of how to approach using it best, but we don't really have a tradition that uses it, at least not like we potentially used to have however many 100 years ago. So with ayahuasca, we're left in this situation where we can potentially use the tradition as guidance. We can use it to inspire how ayahuasca is used in a lab-based setting, in a Western setting. But I do feel that that's a little bit like trying to squeeze a square shape into a circular hole. And we also need to be careful, of course, about cultural appropriation and just about completely appropriating this tradition as well. I think the most honest answer to this one, Jonathan, is I'm not sure. And I would also question if anyone is sure at the moment. What I do know is that ayahuasca is spreading. It is reasonably likely that it will begin to enter the Western medical framework. And I don't necessarily think that that is a bad thing. I think that could provide a lot of healing for a lot of people. But I do think that we need to be very careful and think very carefully about how we do that, about how we give back, how we think about reciprocity with Indigenous communities, how we take care of this, this for what is many a sacred medicine. And yeah, I can see what funds.
Yeah, I wanted to add to that as well. So like, as Simon was saying, like, it's not necessarily kind of like a bad thing if, for it to be integrated into the Western paradigm. And, there are ways to do it, right? And it's how you do it that determines whether it's been well integrated. And I say this because there are, I think, there are really good, it's like Western practice is got many kind of like advantages, and it's got many kind of merits in its own right as well, which might not be so pronounced in kind of more indigenous practices. So when the two do decide to marry, so for example, I'm thinking, yes, the indigenous, the shaman, the use of the medicine songs, the ceremony, the lessons around the diets and everything, are integral, and they're very important part of the dosing experience as well, and there's also the preparation. But then if we're talking about this whole idea of kind of like set and setting and mental preparation, and also with the integration that follows afterwards, and understanding the different kind of symptoms and diagnoses that this medicine could potentially be helpful for, then within the realms of kind of Western psychology and psychiatry, and using some of the models that are being used in the talking therapies, like mindfulness based therapies, or like compassionate based therapies, things like ACT and DBT, to be integrated into those sorts of areas to help people make sense, or it's often been likened to psychotherapy, and there is so many parallels between the psychedelic experience and the ceremony and what people go through in psychotherapy, that I think there is definitely a lot of common ground that could be shared there, and I'd be excited to see how it integrates in the future.
If we're not looking at perhaps integrating ayahuasca within the current medical framework that we have in the West, and perhaps have it as a sort of adjunct treatment in the way in which, Simon, you said, for example, acupuncture is. What do you believe medical regulators and other decision makers within this process would need to see from research that folks like that you are doing to approve, ayahuasca and other compounds that similarly, are not sort of one isolated compound and can just be taken in a pill? What do you think folks like that will need to see?
Mm-hmm. Yeah, I mean, I think we're talking about two different things there, really. So because what we're talking about is already happening. So we're seeing in the United States, for example, obviously across Brazil, that there are places that you can drink ayahuasca that aren't in a traditional jungle setting. So, for example, I'm thinking of the ayahuasca churches. And so we see a decriminalization, a legalization of ayahuasca for religious use in some settings. The research that we're doing, especially the research that's based in the lab, really qualifies or works towards qualifying ayahuasca for medicinal use. And in order to see ayahuasca used for medicinal use fully within the Western medical paradigm, it will have to go through the stages of research, which starts off at assessing whether or not ayahuasca is safe and effective. Fortunately, that's fairly easy to prove because there is research that's been done into ayahuasca already, quite a lot of it showing that it's safe and effective. And then we move on to looking at more specifically whether it's effective at treating different things. So, for example, depression, or maybe even things like alcohol misuse, perhaps, and post-traumatic stress disorder in the future. I think it's quite likely that we will see that ayahuasca is both safe and effective, and also is effective in treating a variety of conditions. And I think we can base that on the plethora of anecdotal evidence that we have of people who have drunk ayahuasca and have had some positive experiences, and also have had safe experiences. That being said, there are a number of people that have had bad experiences with ayahuasca, and there's also a number of these horror stories online of people who have actually died from drinking ayahuasca, and we can't just ignore that. There are risks associated with the use of psychedelics, and there are some people that might be better suited to drinking ayahuasca, and some people that might be less well suited. But I think that through, firstly, making sure what you're actually drinking is ayahuasca, which obviously will be the case within medical trials, you can significantly increase how safe it is, and it is very safe when used appropriately with appropriate people. And also, I just want to point out as well that upon investigation, when there have been, when people have looked deeper into these deaths from so-called ayahuasca, it appears that for each of these cases, it wasn't actually ayahuasca they were drinking; it had been mixed with something else. And then I think the next question comes down to how effective ayahuasca can be in treating mental health conditions. And again, I don't want to, and I can't speak for the curanderos in the jungle, and I've been lucky enough to be witness to them treating a wide variety of conditions using ayahuasca that I would never claim to have the knowledge to do. But I think as a Western medical doctor, at least for now, we need to be careful with conditions that could lead to psychosis when we're using psychedelics. And ayahuasca obviously has DMT in it and dimethyltryptamine, which is an incredibly potent psychedelic. So I think that moving forward, regulators are going to be looking for whether or not ayahuasca is firstly safe in these areas, and secondly, is it effective in treating conditions, and which conditions is it effective in treating?
So perhaps the future of ayahuasca in a medical context might have a similar sort of label that WWE has, in the sort of "do not try this at home" type thing, and more in a controlled setting.
I think it's going to be exactly the same. Exactly the same as wrestling.
Yes, exactly. Yeah.
And earlier we were talking about how ayahuasca can integrate with psychotherapy and psychiatry. In your guys' opinion, are there particular modalities that you see that perhaps are most compatible with integrating with ayahuasca?
I guess yes, like psychodynamic psychotherapy would be one that really comes to mind, but it kind of like, I would say, in elements of many, and I guess any students of psychology will always kind of come that one answer is never really the answer, and it's always kind of quite a holistic view, depending on taking a more person-centered approach, right? You know, just adapting the modality for the condition and the presentation that you are treating. And when I say kind of there are parallels, you know, like I'm talking like, you know, for example, you know, a lot of the research that we've been doing is looking into trauma, childhood traumas, and this and the effects it has on memory, for example, and if we're looking at things like trauma informed kind of like psychotherapies, you know, a lot of it is to do with this understanding that you are uncovering, you know, very deep, difficult memories, traumatic memories that have been kind of buried for a long time, and as you confront them, you know, you are essentially being, you know, you are, I guess, like working towards a state of acceptance of them and being able to move through them and essentially not have them affect your day-to-day life and the symptoms that kind of come with things like PTSD or trauma-related conditions. So yeah, if we're talking about kind of like what, you know, it's an interesting question, because like how do psychedelics work almost, you know, it's like what's the mechanism there, and you know, that starts to kind of dig into its own little rabbit hole. And that's one thing that we're trying to figure out at the moment, like what conditions it is good for, you know, like, okay, you know, we've started to find that it is good for anxiety, it's good for depression, you know, it's good for people with PTSD, but then, you know, what about these other conditions like, you know, like personality disorders, or, you know, neurodevelopmental disorders, or kind of like psychosis, you know, like, which calls for a different set of talking therapies if you were to be, you know, accessing support on in the NHS, for example. So, you know, I guess, in short, I can, to answer your question, is we don't really know. And, right now it seems to be quite a holistic blend, of modalities, you know, like, I guess like some of the modalities of therapy that's been used within King's is kind of like in psychotherapy, and also like compassion based therapies was someone that's also suggested when we were looking at the design for the Melbourne study as well. So yeah, it's in its early stages at the moment, and yeah, it really depends on what kind of participants you are calling into the trials, in terms of what modalities to choose, right?
And I think that's really reflected in the therapeutic guidelines. So when you look at the actual manuals for these studies, and this is true for psilocybin and for MDMA, the actual guide for the therapist is really quite vague. And I think that's, I mean, it's not great for science, but I think it is good for the actual practice of using the psychedelics for the participants. So the guidelines quite often tell the therapist to focus on the inner healing intelligence of the participant. And so basically, during the actual session, the therapist tries to shut up and to not speak too much, to let the participant go within themselves. And of course, if they want to talk about something, or if they're feeling distressed, or if they want to share something, of course they can do that, absolutely. But the guides will encourage the participant to go back within themselves, and that's to go back, put the eye shades on, to put the headphones back on, and to go within themselves. And then most of the therapy actually happens in the sessions before, the preparation sessions, and the sessions afterwards. I think, of course, there are certain therapeutic modalities that lend themselves better to the use of psychedelics. So, for example, acceptance and commitment therapy is a very good one, and psychodynamic, like WaiFung said, and I personally quite like Jung, and so his psychoanalytic theories quite nicely overlap with the mysticism of ayahuasca. There are many therapies that lend themselves quite nicely with the psychedelics, but it's really a case of the participant is in control. They have what we call an internal locus of control, where they can be guided and they can be helped by the therapist. The therapist walk alongside them during that journey, but it's really the participant that's going in and treating themselves. Kind of the opposite to being given an antidepressant and then expecting that to do everything, and you don't actually have to do anything. It's really putting the ball in the participant's court.
Now, counselling is a really good one as well, because of how kind of flexible and versatile it could be. So for example, with the Ayahuasca Foundation, it actually comes within the kind of like retreat and treatment package. It comes with recommendations and also free kind of counselling sessions that help with, both preparation and integration on either side of the retreat. So, yeah.
Now, something that is hotly debated within the psychedelic space is whether practitioners who are administering psychedelic medicines should have experience themselves. Exactly. Should have experience themselves of ingesting and going through that experience that might be elicited in their patients. We have plenty of folks that say it's absolutely mandatory. There are others, like our previous guest on the podcast, Dr. David Feifel, who perhaps was presenting an argument to say that it isn't absolutely necessary for the practitioner to have experienced that particular psychedelic sensation themselves. What are the thoughts of you both?
Yeah, I mean, I think that's a really good question. I mean, I don't think that it's absolutely necessary for practitioners to experience the psychedelic. In fact, I think there's definitely a risk of psychedelic evangelism, where people almost get too into it and get onto, especially in research, a path where they're proving that psychedelics are effective rather than testing whether or not they are effective. So there's definitely a risk that you can lose your objectivity. So I see where people are coming from when they say that. That being said, I do think that it would be more difficult, nigh on impossible, to relate to the experience a participant is going through or has been through if you don't have some idea of what that might be like. And I'm not saying that necessarily has to be through ingesting a psychedelic. Perhaps we'll be able to get to a stage where we can do that through VR or other means, but I can definitely see the benefits for doing it, as well as the reservations that some people in the field or in other fields may well have.
Yeah, I definitely echo what Simon has just said. I really, I personally don't think it is absolutely necessary for someone to have experienced psychedelics, although it would help. But then at the same time, it's like, that, it's like it's going into that, it's kind of like saying psychedelics hold all the answers here, and I really don't think that's the case. And there's definitely room, I think, for therapists to be able to acquire some of the understanding that people acquire through the aid of psychedelic assisted therapies, through life experience, through through a whole myriad of experiences that can help you, enhance your level of interconnection with, in compassion with yourself, with other people, with the world, with the environment around you, like people who, who loved and lost, people who've had, like gone through war, people who've gone through kind of like diseases, like people who have had these experiences that essentially encourage that sense of, I guess, like togetherness or acceptance, and corny as it sounds, kind of like love, with those kinds of traits, I don't have like a list of, or protocol or manual for what a psychedelic assisted therapist should have, but I think a lot of these experiences a lot of these kind of like insights and understandings that people can gain from psychedelic experiences, they can equally gain through life itself. So I think
absolutely awesome answers, both of you, and I think that's a lovely place to wrap up this time round. We'll absolutely have to get you both back on the pod for a future series to hear about some of your upcoming research results. But for the time being, what I'd like to say is, WaiFung, Simon, thank you both so much for joining us on the Professionally Psychedelics podcast.
Thank you so much, Jonathan.
It's been such a pleasure, Jonathan, and let us know when you want us back.
Please take me above.